was very emotional. I was really lonely. I didn't know who to talk to. And then I come to my community. I go to the park. I live in New Holly. People were staring at my child, right? So there was so much stigma.
I don't ever care what other people think. I don't, it doesn't bother me anymore.
Would just go and try to teach more on this topic, more on autism, because right now it is becoming one of the most highest disabilities in the world, not just in the United States.
Let's not be judgmental. I mean, I know parents who have quit taking their kids to the mosque, which is unfortunate. I'll give you a good example. I remember when it comes to Eid, there's a time Eid was the most toughest time for us as families. I think I shouldn't talk about. I get emotional when I start talking about that.
Now I want to introduce, I'm going to give you guys the mics. Please introduce yourself. I'm going to give it to my sister Fatima. Balale.
Assalamu alaikum. Hello. Thank you so much, Somali Health Board and team members, for inviting us, for having this, for continuing for the 5th year, even in the pandemic, doing it on Zoom. So I appreciate the hard work and I feel honored for being here. My name is Fatima Balale. I live in Seattle. I have an autistic child and 2 other children. And I think I consider myself an ally. I consider myself an advocate. And I'm not necessarily an autism advocate because I myself am not autistic, but I'm a parent advocate. My goal is to educate other parents who have autistic children so that we can support each other during the journey, so that we can learn better, so that we can learn from each other. I myself have mentors like Ahmed, like Hamza, who has taught me, I myself, and now I'm learning as I learn. You will see on my social medias, I share what I learn and I learn from others as well, so that I can build a community, not only for myself, but for my son. Because at the end of the day, we all live in a Somali community, and if my son isn't welcome and feeling comfortable in these spaces, neither am I. Thank you.
Thank you, Rueda. Thank you, Fadumo. Somali Health Board, big shout out for Somali Health Board, always coming through for the community. You guys are amazing. Yes, my name is again Hamza, and basically a parent advocate. I live, breathe, sleep, eat autism 24 hours a day. It's something that I'm so passionate about. When it comes to autism, I just consider it a fight that we are all involved. The whole community needs each other. And I consider it part of ibadah too. The more we share about our own struggles, try to help other families, it's considered ibadah. You don't want to see other parents go through struggles or suffer when your advice or your experiences can help that family. So I'm always trying to mentor parents. I'm trying to get fathers getting involved and try to feel the struggle and the pain the mothers are going through. Autism is not a one-parent struggle. You need both hands on deck. You can't just say, you know what, I'll go work, I'm gonna bring the money, I'm gonna make the bread, the mom is gonna take care of this. No, both parents. And I learned it the hard way. Because when he was young, I was like, no, he'll be fine, as I told you guys before. And I came to realize it's so overwhelming for one parent. So for all the single mothers out there that are dealing with it, my heart goes out to you. A shout out to you. Shout out to you. I can't appreciate you more than ever. You guys are amazing. You guys are rock stars. And believe that, always. Every time I go to a parent's house and they tell me, oh, they have autism, the first question I ask, is Abu home? He's like, no, I'm by myself. Wallahi, tears me up. It chokes me, because I know the struggle. I really do. Marka, love to my sisters, to the Hoyos out there. You guys are rock stars. And may Allah continue to bless you, inshallah.
Assalamu alaikum everyone. My name is Muna Mahmoud. I am a sister to a brother who was diagnosed with autism. My brother was diagnosed with autism at the age of 3. I never knew what autism was. My parents didn't know anything about autism. Coming to the United States back in 2014, and he was conceived at that time, being born, him being quiet, thinking that all this had to do with the MMR vaccination, the big thing that the Somali people believe that is brought by autism, which is absolutely, I don't believe it is true. It is something that is genetic. I didn't have help from nobody because I was never in a place where there was resources available to a person of color. I lived in Utah before I moved to Seattle, and I had to hassle and go through a lot as a sister to look into that, because my parents didn't know how to speak English. They didn't know a lot of things, you know. They thought that this was just something that could be fixed out of nowhere because of language. So coming to Seattle and seeing a lot of people advocating for children with autism was such a relief that I had to move everyone out of there and bring my family here so that my brother could continue getting better help over here. Right now, you would look at that child and you would never believe he has autism, because he is very active, very engaging in everything. You know, he would come sit in front of you guys over here and give you guys a whole speech, and you'd be like, wow, look at that child, you know. So as a sister, I am really proud, and there's nothing more that I would not give up to have him, you know. So alhamdulillah for that.
MashaAllah. Thank you for this. Yes. Assalamu alaikum. My name is Hodan Mohammed. I'm a parent, but yes, my daughter has multiple disabilities, Ashwaq. She's a teenager now. That's what brought me to this work. A lot of people know I used to work at Open Doors for multicultural families. They're down there. Shout out to them. I am a great organization. I was there 9 years. I resigned 2020. I was there 9 years. I resigned 2020. I really wanted it. I started as a family support specialist, and I really my whole purpose was to empower and support our African diaspora or our Black families. And I just thought that the disability in the Black community was growing, and I wanted it to start a new organization with the support from Hamza and a lot of other wonderful parents. So I'm the executive director at Washington Multicultural Services, and they're down there. Shout out to them. So we're serving our Black community with disabilities, and and we're located here in South Seattle, and we're looking forward to work with everyone.
So I'm going to start with the first question, and it's going to Hamza, who's a father. Tell us a little bit about your experience through the diagnosis process and how it has affected your family. What are some things that worked well through the process, and what do you wish would be done differently? And then as a father, just talk a little bit about how your experience, how your response has been different from your spouse, because you mentioned earlier, some people don't have a husband that can support them, and sometimes not both parents are on board. So just talk a little bit about your experience.
Great question. When it comes to autism, I can talk all day, basically. First and foremost, there's so much that I've learned from autism. And I'll start also, as a father, how has my response been different from my spouse? That's a really, really great question, because in most cases, one of the parents is always not on board. And guess what? It's always the father who's not on board. And I'll be the first to admit, when I learned about autism, as I said, this was many moons ago. Nobody knew about autism. It's not like we had mentors or we read about autism. It was something that was just dropped on our lap. So, and as I mentioned earlier, it took me 2 years to accept that my son had issues with autism, because my reasoning was, and I always used to tell my wife, is, see, because he's like, speech delayed. It's like, you know what? I didn't start speaking till I was 4 years old. So it's gonna come, don't worry, don't listen to what these doctors are saying. Don't listen to anybody what they're saying. I was also speech delayed. But not realizing I was trying to, it's basically a form of denial. That I was trying to mask my fears of what autism was, is because of the unknown. So that by itself makes us, gives us, parents especially, that dilemma of one parent is holding the other parent's back. But what we don't realize, we're not holding the other parent back. We are holding ourselves back. And we are elongating the process by making it more difficult down the road. Had I known back then what I know now, I'd be on board the first day and say, you know what can we do? I've listened to thousands and thousands of podcasts. I've read thousands of books. I've been in all kinds of forums trying to learn what autism is. And believe me, I'm still learning. All these years, we continue learning. Going through the diagnosis, as I said, is another good advice I would try to give to other parents is, when it comes to diagnosis, it's a really slippery slope. It's a really slippery slope process. What I tell parents right now, having gone through that process before, and I didn't know much, is try to video. You want to know more about autism, you want to really get a good diagnosis from a psychologist, videotape your child. Whatever they're going through during their day, their daily living, just videotape. The more visual tapes you have of your child, the easier it's gonna be, because most of the time this child psychologist is gonna spend maybe about an hour, 2 hours the most. So there's not so much they can learn from giving a clear diagnosis. But if they have the video of what you're going through throughout the day, I mean, their sleeping patterns, their eating patterns, how they're sniffing on their food, how they're chewing their fingers and all that kind of stuff, the repetitive actions, all that is going to give the child psychologist a clear indication. And try to get as many help or many diagnoses as you can. Second, third opinion if you can. Thank you.
Thank you, Hamza. The next question is going to go to Fatima Bilali, who is a mother. And just Fatima, tell us a little bit about your experience through the diagnosis process. How did it affect your family, and what would you have done differently or wish was different? So the diagnosis, a little bit. I'll touch on, I think I'm generally very organized, so I'm using a little bit of an outline. So talking about the diagnosis, I think what came before that was noticing what was going on with our son. And when did we realize he was different and not reaching some of the milestones? When did I realize something was not as it was supposed to be, right? When he was about 9 months, we started noticing things, and this is way before we were eligible for the MMR. And now that I go back, as we think about it, and I have watched videos of him as a child, as an infant, we can see that he was different from the beginning. So he is our second child, and we have another child who's very neurotypical. So as we noticed that he was a much calmer child. And you hear this, oh, you know, he doesn't need as much attention. So as a baby, he was quite easy, which was in itself something weird, right? Babies are never that easy. So he himself was sensory at the time, experiencing some sensory processing issues. But as we didn't know, all I heard was easy baby, calm baby, perhaps too calm. As we got older, about 9 months, he was progressing regularly. You know, he was doing the 2-1 word, he was experiencing any as usual, and then we started noticing he was regressing, right? He wouldn't respond to his name, he wasn't looking at us, and I knew I'm a sort of a hypervigilant mom, and I noticed. And I can see some new moms would have a hard time noticing things like this, but it was so much easier for me because at the time I had a 3-year-old. So as you're experiencing, the experiences were fresh. I remember exactly what Safa was doing at that age. I remember exactly what to expect. Regardless of the gender differences, it shouldn't have been that different. So we thought he was going deaf because he wasn't listening to us and he wasn't responding to his name, and that's the route we went. We had a great pediatrician, but for some reason, and this is about 9 years ago, not a very long time ago, but now, between now and 9 years ago, the difference in diagnosis, the difference in early intervention is huge. Doctors themselves, I believe, are not sometimes as much aware of autism education, they themselves struggle. So I think in a lot of the time, something I wish would have been different was I had hoped I would have more support from our pediatrician who, you know, his whole job was to help us assess our child. I remember having to fight. I remember having to advocate quite heavily, asking him to, you know, refer us because you need some severe referrals. The next part that was the hardest was accessing the diagnosis itself. It's quite a, so you have all of this information you're getting from the internet. Early intervention is best. The sooner you get help, the sooner your child will be normal. One, that's not possible. Your child is autistic forever. You're just mitigating and supporting them. There isn't any normalness, right? If you're expecting normal, that is just the wrong path to go. So, but in that case, the worst part was accessing support, which was very hard. And at the time, I wasn't struggling financially, I wasn't struggling language-wise. I had time, and I know how hard it is for people who have more children. I know people who are who are not first language English speakers. I know people who are new to the country. So imagine I came here as a child and I was having a hard time. So it is quite intensely difficult to get diagnosed. The wait list is long. Happily, I had some contacts and I was able to get my son diagnosed by 1.5, which is quite early. And for us, that was a blessing, right? We got him diagnosed immediately by a huge team of a nutritionist, an OT, a speech therapist, an occupational therapist, a psychologist, and a developmental pediatrician. So a huge undertaking. Took us about a month because he was so small and young, but because he's nonverbal or non-speaking, so you could tell he was autistic at the time. It was easy to diagnose him. Another thing that I wish that was easier was the accessibility. I wish the resources were easily accessible. I wish there were more languages that were available. I wish therapies themselves were accessible, except it's hard for families who don't have private insurance to access some specialties like ABA. A lot of the time now, there's accessibility and they do take Apple Care, but a lot of the time back then, they weren't taking any insurances other than private insurances. Because at the time, my husband was working at Boeing, we had private insurance, excellent insurance, and our therapists weren't being approved, so we had to hire a lawyer and sue our health insurance to get our son to get therapies at the time, which took time and effort and money. So in that case, it was quite an ordeal, but once we got over it, at the time, it impacted my family quite heavily. If it wasn't for my mom and my siblings, my husband and I both completely focused on our baby who was going through stuff. Our 3-year-old at the time was practically being raised by my mom. You know, so in that case, I can understand the struggle of single parents or parents without a lot of family support. That would have been quite an impossible feat if I didn't have someone watching my toddler as I was going from clinic to clinic, as I was spending 6 hours at this clinic, as I was on the internet, as I was going to therapists that were in Kirkland. So in that case, some of that has been better. There's huge improvement. For example, as I was reading, Somali Health Board has a whole booklet on services that can be accessed, which I was talking to Ahmed, and I have more services I'm going to add and send them your way, Reda. But there's so much support. We have Hamza, we have me, we have Amal, we have Hadan. It wasn't the same 10 years ago. There was just so few services available. So I am so glad we have things like this. We have supports in place. We have language accessibility. I'm glad to know that I have a community and I am there for others as they were here for me.
And the next question is going out to Hadan. Hadan, just speak a little bit about what are some challenges you faced as a parent with child with autism, and what kind of resources do you wish were available for you and your family or for the community, since you're also a provider?
As I mentioned earlier, my daughter has disability, multiple disabilities. So Ashlaq has vision impairment, seizure disorder, and intellectual disabilities. The challenge, I think, Father mentioned, she's 10 or 12 years ago, I don't think we had any support system like this. I remember sitting Boyer is one of the early intervention centers in Seattle and I had a lot of white parents around me. I was very emotional. I was really lonely. I didn't know who to talk to. And then I come to my community. I go to the park. I live in New Holly. People were staring at my child, right? So there was so much stigma. But as I grew up here and I knew how to get resources, I kind of went to Google and search. I had, I remember I talked to Asha and I said, Asha, I want you to come and check this program. It's just me, or, this program is not aligned what my child needs. So, I was really fortunate to navigate the system. But the parents that I support every day, they don't have that resources. They have a language delay. They really do not understand how the American system works. They don't understand where to get disability services. Hamza earlier were talking about, single moms. Majority of the parents I support are single moms. And they come and tell me, my child was just recently diagnosed, and I'm afraid I'm gonna lose my husband. He's not on board. Actually, he doesn't even know that I'm in here. What should I do? I have a 3-year-old. I knew he had autism since he was a baby. And I'm frustrated. I have other kids at home that I need to support. So I hear that every day in my office, Somali parents coming in, and other parents as well. And I think the encouragement I give parents is that I do share my story. I also tell them that there is a spaces that they can come to. We do have support groups, come and listen. I do tell husbands, I tell Hamza that, hey, there's other fathers that he can connect with and can talk to, that can really give him, they can go out for a share, coffee, and then just check in. Other thing that I see with other Somali families that I work with is that when the child gets diagnosed, and they get a lot of papers. I advise parents, before you leave that clinic, make sure you get all the information that you need. What does my daughter or my son was diagnosed? What services do you recommend as a doctor that I should follow up with? Where should I go? I see some parents, they get diagnosed at 3. They keep those information at home. They're overwhelmed. There's so much stigma in their community. They don't want the next door neighbor to know that they have a child with disability because they didn't feel welcome. So they come back when they're 10, 11, because the child was kept home. So what I'm really asking the community, if you know parents that are your neighbor, please check in with them. Just, check in with them. Our families are really they're still feeling lonely. And especially, I don't know, someone here mentioned earlier, the language that we use. Our children are normal. No one in this room is normal, right? We're all say we're normal. We're no different than other human beings out there. So I think the languages that I see, especially me being in my office, that people walk in, who do you support? Ilmaha walwalana. Dadka walamayta ku caawisa. Dadka, you know, so it hurts. Community and we know. Adalkeena lu afkeena. It hurts the most ilmaheena. Marka, those are the resources. So I didn't also waxaan ka caawiya special education services. That's another huge area where majority of our families are lacking. They, you know, families want to break, so they just push into their kids in the public school. Where it's also another area where kids are really being isolated and not getting the support that they need. So those are the things that I have been supporting with families.
Thank you, Hadan. The next question goes out to Muna, who's a sister. Muna, if you can share something special that you've learned through your brother and the whole process.
One thing my brother has taught me is patience. I believe most people, which I am part of, never knew the meaning of patience. I would want to go get something and I would expect it to be there as of the moment. I'd be like, well, I'm going to go get that. I have to get it, you know, that's the thing. But he taught me, like, it's not like that. Sometimes with him, the process that I went through, everything as a 19-year-old who didn't know anything about autism, you know, straight fresh out of high school, you get thrown into this, you put your whole life at hold because you're like, what's going on with him, you know, what's wrong, the youngest out of all my siblings, and I love him the most, you know, I don't know why. I love all my siblings, but I guess I just loved him the most because he was just my little baby, I guess. And so he taught me patience, and he taught me to live life as it is and to go on no matter what is thrown at you. And he taught me so many things that I can't even explain, you know. He taught me how to use sign language with him not knowing how to communicate, with him not knowing how to speak back, you know. We had to navigate. He wants to talk to me, but he can't say the words. So I said, what can I do, you know? And one day out of the ordinary, we were watching YouTube and there was sign language being done over there, and he was like, he started signing to me and I didn't know what that was, and I said, oh, okay, we better go learn this, you know. And it took all my willpower to learn that language with him, and I'm telling you guys, whoever has a child with autism, even if your child doesn't have autism, even if it's you yourself, I believe going to go get a skill that is helpful to somebody who you love, somebody who is in your community out of nowhere, it is going to be the biggest joy. It is the biggest moment of your life. So I would say patience, 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 patience. That's one thing my brother has taught me, and alhamdulillah, I am really grateful to be able to have that quality today, that I am able to have patience with anybody that comes across in my life.
I clapped right away as soon as you say patience, because that's exactly what my son taught me too. One thing we don't realize as human beings is we want everything done a certain way, but when it comes to dealing with a child who's on the spectrum, it's a little bit, you have to follow, you have to go according to their tune. You can't force it. For you to understand how their sensory minds work is you have to be as patient as possible. I remember I used to go to the mall. Before I take my son to the mall, I used to go and record the mall. Record the door that we're gonna go into, to all the stores we're gonna walk into, to all the play area that I was gonna take him to. Before we go there, so I come home and I'll show him, this is where we're gonna go, this is what we're gonna do. This is how the door looks like. Because one thing we have to understand, autistic kids, they're visual. Everything has to come through their mind for them to process. Is like they have to understand exactly before. You can't just surprise them and expect them to feel the vibe. So I'll record the video, then I'll come home, he'll look at it, make sure he understands exactly. Sometimes you think he's not paying attention, but he's paying attention. And you'll be surprised as soon as we walk into the mall, he knows exactly how, he's already visualizing. So it's not a surprise. It makes it much, much easier. And it also calms your nerves. I remember I used to take him to Costco for so many years. I'd spend almost 30 minutes outside for him to get adapted to the situation, for him to feel, okay, I belong here. Then we'll walk in. He walk in, couple steps, he walk outside. Because one thing you have to understand is there's the sound, the lighting. He sees all these people. My mind, the way he processes what I see and how he processes are two different things. So I have to be as patient as I can for him to really feel the vibe, for him to get adapted to the situation, to conform his mind to pretty much fixate it to that place before we take the next step. It'll take us 30 minutes. I'll be like, that's fine. Take us 1 hour. We'll sit outside on the floor with him until he feels comfortable. Once he feels comfortable, then we walk in. So, as my sister Mona said, patience. It teaches you a lot of patience. There's nothing, if it's your child, you just gotta go with how they feel.
A lot of the time markaanu ka hadalno autism waxaanu ka hadalnaa a lot of the dibabkayna haysta, the things that are bothering us, the hardships, the challenges. I want to go a little bit, since today I'm here because of my son, I want to tell you guys a little bit about him. So when he was 2 years old, he learned how to read by himself. He taught himself how to read, and this is a non-speaking child, but he can read and write. And he did this all by himself. He learns how to read other languages. Right now he's learning Norwegian and Turkish. We've learned some Mandarin. We have learned some French. We have learned some Spanish. He does that. One of the words that Hamza and some of his friends have come up with for autism is mangar, right? If you know an autistic kid, at least my kid, extremely unique, extremely I wouldn't use the word stubborn, but I would use the word self-assured. He knows who he is. His whole life, he knows who he is. He knows what he wants. He is so confident. A lot of the time, I find that parents struggle with that because our children know what they want immediately, and sometimes it's not what we want for them. And a lot of parenting challenges are we want our children to listen to us, to obey us, to respect us. And respect, I put in quotation marks, because it's really not respect, it's obedience. My son doesn't believe in obedience. He doesn't understand what that is to him. He knows what's right and wrong for him, and he only will agree to that. So the patient aspect from Muna and Hamza and all of us know, and by that I mean, well, a lot of the time you will hear in many autism family circles, an unregulated parent cannot regulate a child, right? Adugu, when you're stressed out and you're freaking out and your child is also having a moment because they're having a sensory issue or they're not being understood or they have a hard time communicating their needs, of course they're a child, they will cry, they will fall on the floor, they're having a hard time. How, Hada, if you now have a freak out and meltdown and you're like, he's not listening to me, oh my God, no, you're the adult, relax. Take the time. Take the space, give your child time to process. And that is, I think, the biggest thing I've learned with patience. How do I step back, look at my child patiently, respect his autonomy, love him, connect with him before I correct him, right? How can I love him first, look at him as my baby, and be like, my baby's having a hard time, he's struggling, let me not add to his stress. How can I alleviate his stress? How can I love him through this hard time he's going through? Because really, it's not me who's autistic, who's having a hard time processing information or the environment. The biggest thing we have to look at that makes autistic people different from neurotypical people is how they perceive information, how they process the environment they're living in. Something as simple as the noise level in a place can completely disorient him. Something as simple as a tag on his t-shirt can throw his whole day off. If his shoe is not the right color, it's my job as his parent to know these things about him. Become an expert at your child. Become the safety net. At the beginning, we had so many issues with him because he didn't trust me to take care of him. I was having a hard time. As soon as I learned to trust myself, as soon as I learned to believe in my child and know that he knows what's right, wallahi billahi tallahi, our relationship is so smooth. Our relationship is so trustworthy. He trusts me implicitly because he knows I have nothing but the best interest. He knows that I am not projecting my needs and issues onto him. I only want what he wants. I only want what's best for him. I will never force him to do something that is against him. When my child understood that, our path became smooth, subhanAllah wa ta'ala. You know, wallah, he is the most smartest kid I know, the most self-assured. He has taught me to be confident. My husband makes fun of me because sometimes when we go out, I go into this bubble, right? A bubble of him and I. It doesn't matter to me if he is having a meltdown, if he's shouting. I stop seeing other people. I don't ever care what other people think. I don't, it doesn't bother me anymore. There is so much shame. So many people have tried to shame me. I have shamed myself. So many people have said to me, are you going to have another son? We have only one son. He's the only son we have. We have 2 daughters, all of them amazing blessings from Allah. How many people have come up to me and like, you have to give your husband another son. I have had that to my face. I have broken down in the bathroom and cried. I have, wanted to shout at people and hit them. But there's no shame. I can never imagine him I couldn't imagine another Jibril. He is the perfection of who he is, and we love him unconditionally. So as parents, look at yourself and be like, nobody is allotted. When you have a child, you're not allotted a perfect child. You're allotted a child. So love the child you have now. A lot of the time, instead of wishing for some imaginary son, right? This son who's talking and doing this, love the one you have who's amazing and wonderful and there, right? So a lot of the time, process as a parent. If you need therapy, get some therapy. If you have sisters like I do, talk to them, your mother, your friends. Process the shame. Look at it, process it, get rid of it. You will love your child unconditionally.
Hadan, you work at Washington Multicultural Services, and I know you guys have a lot of programs. So just go into a little bit about how goals are determined. Can parents and people that are coming in to get services, do they have a say? Can they provide input? Is it covered by insurance? Is it free? What does that really look like? And in terms of goals, how are they really determined? Do you include parent input?
Washington Multicultural Services was founded by parents. It was a parent effort, parent input. I remember talking to Hamza a couple of hours. I talked to other parents because after I resigned at Open Door, my passion is always serving families with disabilities. So I said, okay, and I had a high leadership in that position where I could review data and everything, and that's what brought me to Washington Multicultural. So I did. I called families. Actually, the whole organization was formed by families' input. I asked family, if we start organization, what do we want the organization to look like? They said they wanted a board who looked like the community, that reflect the community we serve. We had, Hamza is my boss, he's the board president. I have a multicultural team who are different African diaspora and African American board members. They're all parents. I have self-advocates meaning an individual with disability on the board. The work that we do every day as a parent, we do for our loved ones. So if we do not include people with disability in the decision making, who are actually we working for, right? So I urge people always include individuals with disabilities because they can really give you a lot of perspective of what they need and how things should be done. So we have that services in our staff. We're a small organization growing. I always believe, I know everyone and I would say everyone. I know some folks have the best interest with people with disabilities because there's some people that do not believe people with disabilities that they should be in the community. And there's a topic that we always had. I'm always in different advocacy groups. But with that being said, what I heard from parents was that we want parents who have gone through the systems. So Diamond is one of their parents. She does the 0 to 3. I have Suleika also is doing the outreach. She's a parent. I have Ayan, a parent. Howie, we just recently hired. I'm a parent. I have a self-advocate. He's a Somali who gone through the system. He's also who's doing advocacy. So that's what the family said. We want people who understands, because you can't be in parents' shoes or self-advocates' shoes, right, to serve, and also have a passion, right? That's another thing that I heard from family was, we want you to hire people who have passion and believe that our children can live in the community, that they can be neighbor and Mona's children, right, and be treated equal. So those are the things that we really took on. And another thing is that we heard we can also have staff on board, but always doing awareness and training. Those were the things that the agency was found on. Services. It's a nonprofit, Washington Multicultural Services, so we basically relying on grant, donation, so all the services are free when we provide it to families. And there's some fundings that we don't get. Our doors open for all families. We're there in the afternoon. We don't send anyone back and say, hey, we're not doing this program because we're not getting these services. We're serving all families. And some of when we're doing a direct support services, actually, we ask families. I know family comes into the space sometimes is not knowing what services that their child is entitled to, right? So we do have a list of, it depends on the age group, right? We talked about 0 to 3. So I asked, that's why earlier I mentioned, a lot of the parents says, yes, I'm receiving early intervention. They say, I have someone who comes into my home, so right away I said, you have early intervention. So what agency are you connected to? And then we go from there, and then we kind of give them an option. These are the services that your child may be eligible. Would you like to apply for DDA, Developmental Disability Administration? These are the things that you can get support. Is your child, do you see child different at home? Is he, hyper? Is he jumping? Is he, hurting himself? ABA. So we give parents actually the option, and they pick some goals because that's, as a parent with a child with disabilities, and then you're trying to navigate the system, is overwhelming. So we kind of go by goals like, okay, let's meet these 3 goals for the first 3 months, and then we come back and do these goals. And then we're always following up with our families, the services that they need. Wallahi, mashallah, the majority, the parents that I work with are so resilient, especially waalidiinta Soomaalida, hooyooyinka. They will show up marka aan wacno, like, hey, these are the things. They're very resilient, and I think they make my job better every day. And so those are the things we do. Also have a support group where we always continue welcoming new parents. And I think sometimes some parents are new, just recently diagnosed. They sit down and listen. Other parents who gone through the systems. We have also our Black family engagement is a monthly. So we talked about. I'm in spaces a lot where we're the newcomers, right? So there are people who paved the way for us. So right now what we're doing is, how do we tackle on what's happening in Olympia? All the bills that affects people with disabilities, right? Making sure that our children is included those bills. So we do a lot of system advocacy, a lot of family engagement, education, and etc.
Thank you, Hodan. Before we wrap up here, just one last question. And this question is going to all the panelists, so please do pass it out to each other. And then this question just says, how can we as a community support families with children with autism or individuals with autism?
I think if any of us look, most of us know a person with autism, right? And not a person, an autistic person, right? So we know an autistic person. I think the biggest difference is they don't need any more than us. All of us need different things, right? If I'm a mom and I'm nursing, I need a quiet space to go there and be private. If my child is sleeping, I need a quiet place to do the same thing. If I'm taking a phone call, it's similar. I believe special needs are all the same. Everybody has a special need that we need. We need privacy, we need accommodations, we need respect, we need compassion, we need kindness. If we practice those basic Islamic principles that come easy to us as a community, if we stop judging differences and looking at, the one time we were at the Somali store for Eid, and you guys know how busy the Somali stores are. He was wearing headphones for noise canceling, and he had his iPad. At this time, he had a phone actually. So he always has his phone. He uses it for communication. He uses it to disassociate. He uses it to distract himself. And he uses his headphones for his sensory processing, auditory issues, where he just doesn't like noise, right? But we had this elderly Somali man who just was bothered by the headphones. My son is only 10, but he's almost as tall as I am. Luckily, my husband comes from very tall people, so he's very, very tall, and he doesn't seem like a 10-year-old. So this man just couldn't leave us alone. He was like, wiilka yar muxuu telefoonka meesha ugu wataa, muxuu headphoneska ugu wataa, ciyaalkan yaryar ee disrespectga ah ee meel kastoo headphoneska wadwataa. Dadka markaa la joogtiin waa inaad telefoonka waa inaad dadka eegtiin kanoo kadeesh. There was a time I would have looked at him and just ignored him, but I was just so frustrated. I had to look at him and like, other, mahosha kugu yar. We have to stand up for ourselves. I spoke to him in a respectful manner, but I'm not teaching my son anything. If I allow him to be stepped on and disrespected by others, he's looking at me to defend him, right? Wala elder, wala child, my goal in life is to make sure as I advocate for him, he can learn to advocate and stand for his own autonomy. So our community, I think we could use a dose of kindness, a dose of compassion, and some non-judgment, right? Let other people be, respect other people's space. If you don't know, ask questions. Keep your eyes to yourself. Keep your fingers to yourself. Keep your words to yourself. If you have nothing nice to say nothing to me. If you're ignorant, that is a you problem. My child will not be exposed to ignorance, judgment, rudeness. I don't care how old you are. If you don't know any better, today is the day you will learn.
Well, I couldn't have said it any better, which is very important, by the way. But most importantly, we need to create spaces for our kids. Most of these kids, they're still kids, so they just need that love. They need to be joyful. Yeah, they might not probably adapt and play with other kids, but at the end of the day, let's create a space for them. Let's not be judgmental. I know parents who have quit taking their kids to the mosque, which is unfortunate. I'll give you a good example. I remember when it comes to Eid, there's a time Eid was the most toughest time for us as families. I think I shouldn't talk about. I get emotional when I start talking about that. But let's create spaces for these kids. I'll come back.
It's a matter of learning, Sometimes you just need to take that little moment to understand that each child is different. I wish parents, siblings, sisters, brothers, friends, anybody would just go and try to teach more on this topic, more on autism, because right now it is becoming one of the most highest disabilities in the world, not just in the United States, in the world. So I wish people would actually go ahead and learn about this. Just the other day, like Faduma said, her son trusts her so much, The same is for me. I feel like sometimes my brother, I am his lifeline. He trusts nobody else except me. Whether something happens in school, whether something happens at home, whether it happens at Duxi, he will call me. He'll write me a whole text message talking about his day, The other day in Ramadan, he texted me and he said, in the middle of the night, he said, and I was here in Mayf, and he said, Muna, guess what? Today I led the Isha prayer, And for a 9-year-old child saying that, I was like surprised, And I said, wow, but at the last time I remember you were in Alif Ba Ta, And he said, oh, you don't know a lot about me. He's like, I know the whole Quran. He said, I know the whole Quran. I can close the kutub and read on top of it, And I was like, mashallah, And I said, why did you go ahead and do that, And he said, somebody said, you're not okay. You're too quiet. Sometimes you get lost on your own, So people need to realize that words doesn't just affect us parents, us siblings, or anybody else. These words, these children can actually hear every single thing that you're saying. They understand everything that you're saying better than anybody else in this room. I promise you guys that much. So these children, we need to be kind. We need to be compassionate, We need to learn through them because this is a blessing from Allah subhanahu wa ta'ala, He put these children on this earth because I promise you this is one of the children that fall on that category where they don't have any dambis, And we are supposed to take part of this ni'mah of educating ourselves and being kind to this because maybe, who knows, they are the way to Jannah for us, They might be that path to Jannah for us. So please take the time to learn, sympathize. When you see a child doing something wrong, do not yell at them, Give them every kind of excuse in the book that you would give them. Like the Prophet ﷺ said, give your brothers and your sisters every single excuse in the book for something wrong that they have done. So be compassionate, whether it's a grown person that you see doing something that you would never do, or whether you see a child doing something that you would not expect out of the ordinary. So pass that message. Tell people about this. Put it on your social medias, If you come across somebody, ask them, do you guys know anything about autism, So let's pass that word. Let's learn. Let's be kind. So thank you guys also for also coming here to take part in this event. Thank you.
Thank you. I think my team here have covered everything. I just want to add, Ramadan Khan, we went to a mosque, and I'm not going to mention which mosque. It was a late night. I really want Ashwaq, to sit there. And I can tell, like Faluma said, the staring. As a mom, we still struggle with those. Why do I always want to educate my Muslim sister about my child? You're not educating me about your child who's hyper, who's jumping around, who's not sitting, who's yelling. The most kids at the mosque that you see, they don't have disabilities, but they have been given the pass to do what they want. But then as soon as our children walks in, that's when everybody starts staring. So I always educating folks, whether it's a mosque, whether it's in my community, whether it's at the doctor's office, the staring. Dadkeena na weeye. Dadka ajnabi kala ma. Waa dadkeena, dad muslimiina oo isku wada dhaqannahay oo diin haystaan, ilmaha saas u wada eegaya. That's one thing. I think another thing I want to mention is inclusion. Inclusion, we want our children to belong all spaces, including the mosque, that they are welcome. Ma fahanti? Another thing that I'm asking Sheikh Yahya, next Eid, we want space scan inaan noo xidhid annaga ilmaheena inay imaadaan oo aan ilmaheena meeshaan ku celebrate gareeno, because sometimes ilmaha disability-ga qabaan noise-ka wuu dhibaa, and you want to make sure ilmaheena inay safe yihiin. Like earlier, I think Faduma mentioned, I stopped hanging around with friends. All my friends have children with disabilities. All my friends. I do not go to spaces where my child's not welcome. Period. You're not my friend if you're not making room for my child, right? All my friends, right? So it's if you know I'm coming over, I'm bringing my child, you need to give me that room for my child also to feel welcome, right? So I'm looking at you, yeah, this is the first time I've been here, so, you know, this is a nice place, and I really want a place where we get a lot of volunteers. I urge you guys all to sign up to support. You know, we can use a lot of extra one-on-one support, and asking Sheikh Yahya to mention no hero, inshallah, next Eid. Thank you.
All right, I wanted to say thank you to the panelists. Give them one last round of applause.